everyone, welcome back. I'm Dr. Nancy Rahnama. I'm an obesity medicine specialist, and we're discussing your top questions regarding the new weight loss medications available now. So let's get started. Okay, so what are the side effects of these drugs? Well, let's first establish that you've been prescribed this drug by a healthcare provider who knows you, your body, and has made sure that this medication has greater benefits than risks. So what are the risks? Well, if you use the drug inappropriately and you don't use it to change what you eat, how much you eat, and when you eat, you're going to experience gastrointestinal side effects. Those include nausea, vomiting, diarrhea, constipation, acid reflux. If you don't use the medication appropriately and it makes you stop eating, then that can cause hair loss, fatigue, muscle loss, cold body temperature. If you don't drink enough water while taking this drug, that can actually result in acute renal failure because your kidneys are not hydrated efficiently, because the drug also can decrease your thirst just like it decreases your hunger. If you lose too much weight too quickly on this drug, you could put yourself at risk for developing gallstones. But the more serious one is that if you don't change what you eat and how much you eat, you could put yourself at risk for pancreatitis. So it is absolutely essential for you to make sure that A, this drug is right for you, B, that it's helping you more than it's hurting you, and C, that you're followed by a healthcare professional who's monitoring you for these side effects. If you are, this drug can be life-changing. It could change your whole outlook on the world and finally help you reach the goals that you've always wanted. So how long can you stay on these drugs? Well, these drugs are meant to be taken indefinitely because they are treating a chronic medical problem. A chronic problem is a problem that we know will never go away. You could treat it, but the issue will always be there. So for example, diabetes. Someone can be a diabetic, they could treat it and not see it in their blood work, but it's because they're on the drug. The same goes with these GLP-1 medications. We know that obesity is a chronic medical problem. So giving you something that fixes it is supposed to be for long term. If you stop the drug, you're gonna feel hungry again. So just as if you would be established as a patient who doesn't produce enough thyroid hormone, you would be prescribed thyroid replacement. The same would be with GLP-1. Depending on a patient's evaluation and their history with weight loss, it's clear to establish that someone doesn't produce enough GLP-1 hormone. So giving them back the GLP-1 protein is correcting the problem. And so if you stop correcting the problem will come back. Patients often ask me, what will happen if I stop taking this drug? Will I gain my weight back? And the answer is maybe. There are many different types of individuals who struggle with weight and reach a state of obesity, and then they start taking this drug, and there's many different ways the drug can help them. So for example, if an individual is deficient in GLP-1 because of their history or their genetics, then giving them back this protein is essentially fixing a problem. And if they stop taking it, they will feel hungry again and reach their previous weight. However, there are certain patients who have obesity as a medical problem because of the fat they carry. Meaning, when someone reaches a certain weight, the fat that they carry causes a hormonal problem that leads to overeating, and it's a vicious cycle that repeats itself. If the individual is able to successfully lose their fat, then the problem can go away entirely and the individual can successfully taper down the drug and possibly succeed without it. There are those individuals, however, who are at an obesity state because of their eating behaviors. And if they're able to totally, completely change their eating behaviors, change what they eat, when they eat, how much they eat, and they learn how to eat correctly for their bodies to get to the weight loss goal that they want to be at, those patients, if they're able to stay with the same behaviors, can also successfully taper down the drugs. Now, you have to understand that in each different situation, you have to be monitored by a physician to know whether you can do it successfully or not. Thanks so much for watching. I hope you've learned about how these new weight loss medications can be life-changing when used correctly and the dangers when not used correctly. And I hope that you loved this video. If you did, make sure you like below. Make sure you subscribe to our channel to make sure you're up to date on all the new technologies and science behind clinical nutrition, gut health, and obesity. And if you haven't watched part 1, make sure you do so. And thanks for watching.